Hello, I'm Susan Cole.
And I'm Vanessa Apea.
And welcome to Health and Power, the live broadcast series on health inequalities affecting people of colour and crucially steps we need to take to address it.
Thank you so much, Susan. And I say every month, but today is no exception. So we have fantastic guests on today, and as ever, really looking forward to it. And we've got two people that from very giving us different perspectives of two different areas. So really exciting. So we've first of all got Jenica Leah on, who is an award-winning author and industry expert in sickle cell. She's won multiple awards for her children's book series, blogging platforms, and speaking, and runs sickle cell organizations both in the UK and the Caribbean. And I'll give you a sneak peek that we're actually speaking to her from Jamaica today. And Jenica was born with sickle cell anemia, surviving a stroke at 14 and recovering from a hip replacing at 25. And Jenica's patient expertise places her really second to none when discussing sickle cell and other invisible illnesses. And she's really dedicated to bringing more awareness to sickle cell, given though it is one of the most common genetic disorders in the world, but yet many people still don't know much about it. So she really believes in creating awareness, and that'll lead to a better understanding of the condition. So we're so glad that Jenica is here with us today. And then we also have Ade Adeyemi, MBE, who is a global health policy expert who works for the UK Department of Health and Social Care. And he's also on the steering committee for an African Union Centre for Disease Control Fellowship Programme. And Ade, having started his career actually in the pharmaceutical industry, he's had over 15 years of healthcare strategy and policy experience. And he's worked in the Mayor of London's office, UK Parliament, and in both local and national roles of the NHS. And he was a former director of Chatham House, the Royal Institute of International Affairs think tank. And here he supported Ministry of Health stakeholders across Africa. But also, in addition to all of that, Ade's now studying for his PhD in global health and social medicine at King's College, and also has an MBA. So we have got fantastic guests. And as ever, we talk about it, but I think it's so important for us to hear people's backgrounds and all the work that they've done in their lives to get them to this point. So we're really glad that we've got them on today.
Absolutely, it's really exciting, and I really agree with you. Is that it's so important that we actually hear, and the level of expertise that we have in the show is incredible. But Vanessa, I have been working that much this week because, as you know, I had a concussion. I actually fell over telling off my teenage daughter. So I think it's either karma or one of those teenage curses. But one thing that I was told to sort of stay off my computer, but I was sort of like checking about some of the stuff was going on, and I saw that you were in a conference in America. So what came up there?
Yes, I was. I was at ISSTDR, which is an international sexual health and HIV conference. And it was in the beautiful city of Chicago. And I have to say, first of all, I didn't really know what to expect about Chicago. It was lovely. So we had an amazing time. And it was a great time to network with colleagues, both from the UK that you just don't get to see as much, and also colleagues globally. And there was actually, we talked about so many different things related to sexual health and HIV. And as ever, things going on here replicated in the US and beyond. So it was really an exchange of ideas. But one of the things that really came up a lot was congenital syphilis. And sadly, we are seeing higher rates of syphilis globally. And with that, we are seeing significant rates of newborns being born with syphilis. And so in the US, they were saying that it was 3 times higher in 2020 compared to 2016, and was on the increase again. And that had resulted in 220 stillbirths and infant deaths. And we are seeing rates going up in the UK as well. So lots to talk about, but also talking about the disparities within that, because a lot of those cases were amongst Black women and Hispanic women as well. Yeah. So really sobering.
Yeah, absolutely. Yeah. So shall we bring on Jenica now? Because we've got so much to be going through. Wonderful to see you in beautiful Jamaica. How are you?
I am wonderful. Thank you so much for having me.
Fantastic. Jenica, we spoke, Vanessa and I spoke a little bit about sickle cell in the last broadcast, but we're really keen to hear from you to explain what exactly it is, because there's so much confusion, I think.
There is, because I think there's one main thing people know about sickle cell. So essentially, sickle cell is a disorder. It's a genetic condition. So it's passed down from both parents, and it affects the hemoglobin in the red blood cells. So in our red blood cells, the hemoglobin is responsible for helping the red blood cells to carry oxygen all around the body. And in people that live with sickle cell, our hemoglobin is deformed, so to speak. So what that does, it makes our red blood cells misshaped, kind of like a letter C, as I like to say, or a banana, or a sickle shape, which is where it gets its name from. And it becomes hard and sticky. And because the red blood cells are usually supposed to be squishy and easily flow through the blood vessels, people with sickle cell, when our red blood cells become hard, sticky, and difficult to flow through the blood vessels, that causes blockages in the veins, what is known as a crisis. Now, when a crisis happens, it's extremely, extremely painful. And I think a lot of people associate sickle cell with the pain. But what also comes with it is, if you imagine, everywhere blood flows, our bodies need oxygen. That's how we survive. Whenever the oxygen is cut off from a particular part of that body, when a crisis occurs, it also restricts that part of the body from getting what it needs. So the lack of oxygen can lead to organ damage. It can lead to bone death and needing surgeries because, your bones are not getting what it needs. It can also lead to blindness, issues with everything in the body. So, and essentially it can actually lead to death as well. So it is actually a fatal condition. And, it's not talked about enough. It's not known of enough, really.
No, thank you, Jenica. I think it's really powerful, you explaining it. And I think that with that, so many people don't know about it. But many people with a lived experience of sickle cell may not necessarily do what you've been doing and saying, despite all of this, I'm going out there and I'm going to share and make sure people are educated. And so we were just really interested in what pushed you into advocacy, moving from, lived experience to say, I'm going to be in that space and I'm going to really be forceful in making sure that people understand about it even more.
I definitely think it's because of the experience that I had. I feel like my journey with sickle cell has been the way it has been because I didn't know a lot about it, and because there wasn't enough education and awareness around when I was a young child growing up with sickle cell. And what I started to realize was the same things that I went through, I see my, younger generations going through exactly the same thing now. And it's heartbreaking. I know I've been through it. I've had so many different complications, and you somehow have this thing in your mind where it's like, okay, I can handle it. But to watch another child have to go through that, it's so difficult for me because I know exactly what that feels like. So I really wanted to make a difference. And the pivotal point for me was, at that early age of childhood, which was what prompted me to kind of write children's books, not only to educate, all different children about sickle cell, but also to give children that live with sickle cell the confidence to speak about their condition, because I didn't have that.
And that's absolutely so brilliant what you're doing. I mean, we're conscious of the fact that it's predominantly people of color who are affected by sickle cell. And we've heard the most harrowing stories from people in terms of just like shocking care. I mean, what kinds of experiences are you hearing about from people with sickle cell?
I think the main thing that we recognize is that because sickle cell, doesn't only affect Black people, but it predominantly does affect Black people. Healthcare professionals carry, I guess, their misjudgments of Black people and Black culture with them into the workplace, which unfortunately affects the level of care that we receive. So we do get labeled as drug seekers when we, present in A&E in agony. And, this is something that we've lived with. We know what works. So someone saying, I need morphine, it's not because we're seeking drugs, it's because that's the only thing that's going to help. And for a lot of people that live with sickle cell in the communities, by the time we get to that stage, we don't actually want to be there, right? We just want to get in, get what we can so that we can get better and leave. And, we are ignored, we're not believed. There's also, a lot around kind of, I guess, people expecting that because we are Black, and I know that this happens in women during pregnancy as well, that we have a higher pain threshold. I've been in situations and heard people say situations where they, will be crying in pain and they're told, to kind of be quiet, hush up. And someone who's not Black, it will be crying in pain. And it's like, oh my gosh, is everything okay? Can I do anything to help you? And we're all human. It's unfair. It's really unfair.
No, thank you, Jenica. And it's, being a healthcare professional as well, and listening to this, you always find it so painful because number one, that what you're saying is exactly the truth, and this is what people experience. And you also know that things can be done so much better, and there's a real gap there. So and I think it's really powerful coming from yourself as well, because I think many people who may be affected by sickle cell, whether it's themselves or their family members, don't often feel they have a voice to say, this is wrong and this needs to change. So from your point of view, if you were going to say, right, what was the ideal shape of sickle cell care? You've talked about some of the problems there. What do you think needs to change? What would be your call to action to say, right, this is what we need?
I think my initial call to action would definitely be, more education around sickle cell. Now, there are so many diseases in the world. So, we can't expect every single healthcare professional to know about every disease that someone may present with in A&E. But sickle cell is, the most common genetic disorder in the world. It's also the fastest growing now as well. So this is something that it's not going to get any better. And so it's something that is very important that people know about. I've spoken to nurses. I mean, many of my family members are healthcare professionals as well. And even in their training, it's a paragraph in a book, or it's just one, it's just one lesson. And sickle cell it's not textbook either. So I think as well as there being more education, we also need to just encourage more empathy and actually listening to patients. It's really important because you're not going to know everything. And what we are, people that live with sickle cell that have, we're talking decades of experience then. I don't have a PhD or anything, but, I have a PhD in my own life, I like to say. So I am an expert in my condition. I don't know everything, but I think with listening to the patients and having that open line of communication with patients, it's not about who knows more or who has a higher level of education. It's about working together to ensure that our care can be improved.
Yeah, absolutely. And how can people support your work?
Well, I run a nonprofit in the UK, which is called My Friend Jen. And we, mainly help people to understand more about sickle cell. We raise awareness about it, we educate it. We recently had a huge fundraising event, and thanks to one of our gift sponsors, actually, we're still offering the chance for everyone to participate in a prize draw to win a 4-night stay in a beautiful, beautiful hotel in Jamaica. So there is a link on your screen. It's myfriendjen.co.uk. /events, but also check out the website. It has a lot of our work on there. If you go to on the website, you can see all of our projects that we currently have going and what it is that we do in the community. We mentor young people. We go into schools, we go into businesses. You know, we try and do as much as we can to raise awareness of sickle cell and educate the community.
Wonderful.
Wonderful.
Thank you so much, Jan.
Thanks for having me. Thank you so much. I'm so glad.
Brilliant to have you. Thank you.
Great. Take care. Thank you.
Thanks. Oh my goodness, that's so powerful and just so important to actually say, you know, I have a PhD in my own life and experiences.
Definitely. And there was so many lines there just to really pick out. And I think when Jenica was talking at the end about patient empowerment, patient engagement, you know, making sure that people living with a condition are front and center and are listened to. It's, you know, things that we say many times, but it's not enacted enough. So yeah, really, really powerful words from Jenica. And I'm going to be going on the website to get the holiday.
I will be as well. And I mean, one thing that really struck me was just the experiences of Black women not being believed, you know, when we talk about our pain. And I mean, one thing that I've been really conscious of just in the last few days was just the most horrendous stories in the media. There's one in Croydon, where I live, where a mother was like held by the police and handcuffed in front of her young child who was crying in terror about potentially not having a ticket for the bus. It turned out she did have a ticket, but just the way that she was treated. And then another just horrendous story of a pregnant Black woman who gave birth alone in prison and didn't get any help, and her baby really sadly died. And it's really traumatic hearing these stories, and we hear them over again and again, and I think it can really impact on us sometimes.
No, definitely. And, you know, even when you're just saying the words again just now, it kind of hits you inside, just even started thinking about it. And I think one of the issues that I think we talked about previously is that there was a video going around around some of these, and it's incredibly traumatic. And I think that it's important for people to share and for us to discuss, but also for us to think about how it impacts us after we've visually seen something or after we've read something. And it's a difficult time for many people. And I think we need to create spaces in which we allow people to talk about it, talk about how it's impacted us, how it affects our day-to-day living and how we think about ourselves, and also think about the solutions. What do we do so this doesn't happen again? And it's Health and Power was part of that, wasn't it? Just for us thinking, right, how can we talk to people about what solutions they've got? But you're so right, it is incredibly traumatic. And I think it's perhaps something we'll talk about again in terms of people that create psychologically safe spaces to discuss it more. Yeah.
Absolutely. Well, I'm glad that we have Health and Power as a safe space to actually have these conversations.
Definitely. And so I think, should we call on Ade to come and speak?
Yes.
Hello.
Hey.
Hi, Ade.
How you guys doing?
Yeah, good. Thank you. Thank you so much for coming on. Not somewhere glamorous like Jamaica at the moment, are you?
No, I think where I am is just as glamorous. East London, Stratford.
Almost as glamorous as Croydon, where I am.
Yeah. I think I top it because I'm in Whitechapel, so there we are. But yeah, no, Ade, again, thank you so much for coming on. And it's really interesting because one of the reasons that I had reached out was because I'd seen your work, because I am a fellow East Londoner, and you have a series in which you do videos in the community, and you just speak to people from East London, and it's something that's really resonated with me. So one of the first things that I wanted to know is tell us a bit more about that project, if you wouldn't mind, and what led you to do it.
Yeah, well, I've lived in East London all my life. I'm in the same council house that I grew up in as a child. And I've worked in 15 years across the NHS as a ward clerk at Goodmayes Hospital to NHS England, and now the Department of Health. And most of the work I've been doing, policy, kind of using my skills, has been at a national level. And as I've now got kids and thinking about the future, and there's opportunities as the world is shifting, just really, thinking, well, what can I do for the place that, I call home and I've lived all my life?
Yeah.
So just taking a real interest in, getting stuck in and trying to make a difference locally, because I've got some ideas, and this conversations are a way to engage with more people to kind of flesh out those ideas and see how best my skills of policy and advocacy can kind of help my home.
Love it.
Brilliant. That's fantastic. I mean, quite a lot of the focus of Health and Power is like looking at health inequalities in the UK, but I'm really conscious that there's still really staggering inequities between countries as well as within them. And certainly, I mean, for me, my dad died of COVID in Jamaica last year, and I was really conscious of the fact that his experience was dramatically different to the experience of my mum, who had COVID just a few weeks before in the UK, and that my dad didn't have access to the treatment and care that my mum had. So I know that quite a lot of your work is on international health inequity. So have you been doing any work around COVID globally?
Yeah, quite a bit. So actually, during the height of the pandemic, I was in the main executive agency of the NHS called NHS England, and I was working with the armed forces and the Navy to secure vital medical equipment and PPE into the country. So and I was also chair of the BAME staff network for NHS England, so at the forefront of both kind of the staff workforce response to the pandemic, and then also some of our kind of commercial activities, getting supplies for the country. Now in the department as well, I've now had another viewpoint of, our relationship with other countries. So the UK had the presidency of this big group of nations called the G7. There's the G20, there's the World Health Organization. There's all these multilateral platforms, as well as the bilateral one-on-one relationships we're trying to have with other countries to improve health everywhere. Because, if someone's sick one place, then we're a very globally connected world. We'll all kind of get sick. So I've kind of seen COVID inequalities at different levels within different countries, and there are stuff we can do to reduce that inequality, to reduce disparities. Vaccine sharing, sharing of PPE equipment that we may be able to have an abundance, etc. It's interesting, and there's still a long way to go.
Definitely, and I think just having that mindset of thinking globally, like you just said, sharing. So not just thinking what we do in isolation in one country, but then how we can support other countries and vice versa. So it's really interesting. And I think another piece of work that I think is really crucially important, and it was great to hear that you're kind of at the forefront of the work, is with the COVID inquiry for healthcare workers. And I was saying that as a healthcare worker who worked within COVID, it's been really interesting to me. I don't know if interesting is the right word, but I've been really reflective of how my emotions about it have evolved over the years, and sometimes certain memories that you haven't even thought of before just suddenly come up again. And so I think it's great that there's an inquiry to just make sure that people have an opportunity to really reflect about their experiences, to make sure they get the change that they'd like to see. So could you tell us a bit more about the inquiry?
Yeah, well, the inquiry is the biggest independent public inquiry the country's ever had or known. And because it's so big, they're kind of chunking it up into modules. So, you know, how the country, how the government prepared for the pandemic is like module 1. How the government responded is another module. You know, vaccines is another module, etc. But so before the inquiry kind of became, as I said earlier, when I was at NHS England at the height of the pandemic, I was chair of the BAME staff network, and I could see that there was a need for ethnic minority healthcare workers to make sure that their voices were heard within this process. There are a number of ethnic minority staff care organisations within the NHS. There's, you know, the Kenyan Doctors Association, the Association of Pakistani Nurses, etc., etc. And we've all come together, over 45, 50 of these networks, under one big umbrella called the Federation of Ethnic Minority Healthcare Organisations, FEMHO. And we have got legal counsel, and we're talking to the inquiry. So we've got core participant status, we've got legal official status in the inquiry to kind of have our voices heard, to engage. And across some of these modules, we really want the, you know, the impact, the disproportionate impact on ethnic minority healthcare workers to be visible, and for us to understand why that happened and what we can do within the health service at all different levels to make sure that doesn't happen again.
Yeah, absolutely brilliant. And you can see there's the website flashing up now if anyone would like to.
So femho.co.uk/evidence. You know, we've captured probably over 50,000 nurses and doctors and clinicians in this group. But there's probably more that don't exist in those networks and don't even know that those networks, this network of networks exists. So the more people that can kind of give us their evidence of what happened, how they felt, what happened on their ward or in their clinical setting, then, you know, the stronger voice we have to talk to the, you know, chair of the inquiry and to the people that are kind of looking at what laws need to change because of what happened. So yeah, we want everyone's stories to be reflected.
Absolutely, that's absolutely brilliant. And just finally, you're talking about laws that need to be changed. I mean, what action do you think needs to happen now to bring about meaningful change in terms of addressing some of the health inequalities that we've been seeing, quite frankly, for generations?
Yeah, well, that's a good question. And, you know, in anything, there is always a kind of push and pull. There's there's a carrot and a stick approach. So something you use to entice and incentivize good behavior legislatively, you know, with people that law applies to. And then a stick, you know, things that you use to penalize bad behavior, which is also another way to incentivize good behavior. And I think we see in many parts of law, and, you know, there's clinical negligence laws, which means, you know, some clinicians are really apprehensive about not doing, you know, bad practice, and that's good, and they morally do that anyway. And so equally, you want the right level of carrot and stick that incentivizes and marshals good behavior across the healthcare system. So from the ward to, you know, a regional clinical commissioning group or integrated care system or a national level, people that are implementing policies or commissioning services or doing something know that, one, it is the right thing to do to make sure it doesn't exacerbate inequalities, but two, there is a very strong stick that if you do something that does exacerbate inequalities, then, you know, there will be punishment. There are things like the Equalities Act that do that at a macro level, and that applies with all sorts of things. You can't fire someone for a protected characteristic, etc. So that same level of really strong legislative action that stops a particular action from happening, you know, I'm interested and hopeful that that kind of thing will happen for ethnic minority healthcare workers, so that we never ever see this kind of disproportionate impact of more Black and ethnic minority healthcare workers dying than white workers. And the answer exists out there, and I hope we'll get there.
Yeah,
Brilliant.
No, that's beautifully put, and I think it's inspired, as I say, as a healthcare worker, just thinking that there's going to be something that's going to be advocating for us in that space is so important. So no, thank you. And the website has been on, but we'll be sharing it with all our friends and colleagues to complete it as well. But thank you so much for coming on.
Thank you.
It's been wonderful to have you. Thank you so much.
Thank you.
Oh my goodness, where has the time gone?
The pressure's on,
Absolutely.
it goes so quickly.
I
Oh,
know.
God.
So huge thank you to our guests for coming on. Been absolutely brilliant. Thank you so much for Disruptive Live for their technical wizardry and making all of this work. Thank you to the lottery for supporting us to make this possible.
No, definitely. And as always, thank you to you, Susan,
Thank
particularly
you.
post-concussion. We love it. Thank you. And we will be back on the 21st of August. So looking forward to that then after. So have a good summer weeks, wherever people are, whether in the UK or in Jamaica.
Okay. Thanks very much. Thanks, everyone. Bye.
Take care. Bye.